Stem cell therapy is one of the most searched, most misunderstood, and most marketed areas in modern medicine. Some call it the future of healthcare, others call it unregulated hype. The truth is somewhere in between. And that's exactly why clarity matters. I'm Dr. Priyanka Mathur, physician, global health and wellness navigator, healthcare entrepreneur, and founder of MediPocket USA, a physician led global medical concierge platform. I have worked across multiple healthcare systems internationally, advised healthcare and technology companies, spoken globally on healthcare innovation, and built physician led platforms focused on precision, access, and complex case navigation. Today, I want to explain what stem cells actually are, the different types, where they are truly evidence based, where caution is required, and how to access the right experts in regulated centers in the United States. Because in regenerative medicine, the wrong clinic can cost you more than money, it can cost time, safety, and opportunity. So, what are stem cells? Stem cells are unique cells with two defining properties. One, they can self renew, and two, they can differentiate into specialized cell types. Now, there are several major categories. Number one, hematopoietic stem cells, HSCs. These are blood forming stem cells used for decades in leukemia, lymphoma, multiple myeloma, certain genetic blood disorders. Now, in the United States alone, more than 20,000 hematopoietic stem cell transplants are performed annually. These are highly regulated, hospital based procedures. Mesenchymal stem cells, MSCs, derived from bone marrow, adipose tissues, or umbilical cord tissues. They are being studied for orthopedic repair, cartilage damage, autoimmune diseases, inflammatory conditions. However, and this is important, not all MSC clinics operate under FDA approved protocol. Now, the third is induced pluripotent stem cell, iPSC. Now, these are reprogrammed adult cells turned into pluripotent cells in lab, currently largely research based, especially in neurology, disease modeling, drug discovery. Now, fourth is embryonic stem cells, primarily used in research due to ethical and regulatory complexities. Understanding which stem cell type applies to which condition is critical. Now, where stem cell therapies are legitimately used. Let's separate science from marketing. Oncology and hematology. Bone marrow transplantation is standard of care in many blood cancers. This is not experimental, it is decades established. Multiple sclerosis, selective cases. Autologous hematopoietic stem cell transplantation has shown strong remission rates in aggressive relapsing multiple sclerosis, but only in carefully selected patients and specialized centers. Orthopedics. Now, stem cell based injections are being studied for knee osteoarthritis, tendon injuries, cartilage regeneration. However, outcomes vary significantly by protocol and patient selection. The other is cardiology. Research trials are evaluating stem cells for myocardial repair after heart attack. Autoimmune disease. Now, certain centers evaluate stem cell transplantation for refractory lupus or Crohn's disease, again, highly selective. So, what's the problem? Marketing often outturns evidence. The problem, unregulated stem cell clinics. Now, the FDA has repeatedly warned against clinics marketing unapproved stem cell products for anti-aging, autism, ALS, Parkinson's, cosmetic regeneration. Patients often travel internationally or to loosely regulated clinics. Risks have included infection, blindness in some reported cases, tumor formation, financial exploitation. This is why regenerative medicine requires regulatory oversight, institutional expertise, proper patient selection, risk benefit analysis. So, how MediPocket navigates stem cell access? At MediPocket USA, we do not sell stem cell treatments. We architect decisions. Here's how we help. Number one, case review, then diagnosis confirmation, eligibility assessment, matching with the regulated US specialist, risk benefit mapping, and post treatment coordination. We work with academic centers, board certified specialists, FDA compliant pathways, because not every patient qualifies, not every condition responds, and the timing matters. Regenerative medicine is powerful, but only when guided by medical intelligence. Now, the future of digital twins and regenerative medicine. The future of stem cell therapy may involve digital twin modeling, virtual simulations predicting how a specific patient might respond to cellular therapy. This moves us toward predictive medicine, less guesswork, more personalization. But again, this must be physician led. Stem cell therapy is not magic. It is not universal. It is not cosmetic. It is one of the most promising fields in medicine when used correctly. If you are exploring regenerative options, oncology, autoimmune diseases, neurological conditions, orthopedic injury, MediPocket Global Medical Concierge helps you access the right experts in the United States. Not hype, not guesswork, structured physician led navigation. Visit medipocketusa.com or inquire about our sovereign membership to begin with clarity.